Hi, my name is Sue Brown. I work on the Microsoft Health Common User Interface project. This is aligned with the NHS National Health Service Common User Interface programme in the UK. Our aims are to promote patient safety and clinical effectiveness. What I'm about to show you is a patient journey demonstrator. Its purpose is to align patient safety, output from the Microsoft Health Common User Interface programme, clinical functionality and excellence in user interface design. We've built the demonstrator in Silverlight 2, Microsoft's new rich internet application technology, and in doing so are offering new ways of visualising, understanding and engaging with clinical data. The demonstrator combines user interface guidance and controls produced for the NHS CUI programme with new exciting ways of using the new Microsoft Silverlight technology. I'll start by showing you the administration demonstrator. This screen shows a dashboard for an administrator, and on the dashboard you can see certain types of information, such as information about how to register a patient, repeat prescription requests, and the schedules for the GPs in the particular surgery. What I can do with these panels is swap them about, move them around to change the screen to focus in on something that I want to see. So for instance, a particular GP schedule for the day. I can also view the schedule in a certain different way, just to highlight the available and unavailable slots for that particular GP in his schedule for a particular day. The other thing I can do is I can search for patients. So our scenario starts with Mr. Brian Johnson ringing up the surgery to ask to see a doctor. He's suffering from chest pain. So I'm going to go ahead and search for Brian. So I type in the start of Brian's name, and the search allows me to find a particular patient that's registered with the surgery. I can slide up some more information so that I can check that I've got the correct patient. I can check his date of birth and also his postcode. I can also increase the level of detail to show a map of the location of his address. So if the GP were to be called out to visit the patient at home, they have the address and also a map of where to find them. So I'm going to go ahead and book an appointment for Brian. So I'm going to just drag and drop Brian onto a GP's schedule for the day. So I can see here that Brian has been booked in to see Dr. Oliver Cox on Wednesday the 7th of May. I'm now going to move ahead a little bit in time, and Brian has come into the surgery, and I'm going to open up the GP's dashboard, and we need to imagine that Brian's sitting in front of the GP about to start his consultation. So I'll go ahead and launch the primary care demonstrator that shows the GP's dashboard. So what we see here is our GP, Dr. Oliver Cox, and his schedule for the day on the left-hand side. We can also see that in his other panels he also has other sorts of information that he would expect, such as knowledge support, maybe a practice notice board, some information about repeat prescription requests. But also we can see that we've booked in Mr. Brian Johnson, and as he's in front of us we'll go ahead and open up to view the patient's record. So what I can see here is a number of panels relating to our patient. I'm going to go ahead and look at the most recent activities. So as I open up this panel, I can see there are a number of consultations. I want to actually compare a number of those consultations. So I'm going to take a look at the essential hypertension and just pick 3 of the last consultations that we've had to do with that particular condition. And I can drop down to see a bit more information about those consultations and compare and contrast some of the observations we took as part of the consultation. So for example, blood pressure, I can see that when he came in April, June and October, Mr. Johnson's blood pressure has steadily risen. The other thing I can do is group by problem. So if I want to view all of the essential hypertension episodes, I can pick that up and drag that across to the doc. And I can use our tool down the bottom here just to slide around the consultations. So I can compare and contrast and take a look to see if there are any recurring patterns for our particular patient. The other thing I would like to do whilst I've got Brian in front of me is also to take a look at some of the chart information. So here I can see the same blood pressure readings over time, and I can mouse over on individual readings taken for the patient. I can also overlay on top of that the medications that the patient was taking.
So I can see here that the medication has a direct effect on his blood pressure readings. And I can see that we needed to make some changes to the drugs we were prescribing him, and that unfortunately it looks like we needed to lower the dosage on one drug. And for that reason we had to prescribe him with a different medication for the same condition. I'm also going to add on his creatinine level, just so that we can check for any signs of renal failure. And you'll see there's a correlation between the blood pressure, the medications, and also the creatinine level, which spiked at the point we increased the dosage. This helps to explain why the different drug was prescribed.
The other way to view this data is via a table or a data view. And I can use my slider bar along the bottom here that looks at information over time, and you can see that's updating in real time. I can also add cholesterol levels as well, and go back to the chart view to see the cholesterol level added in there, and I can drag that to the top to get a better understanding of the information. The other thing I want to show you is medications. I'd like to take a little look at some of the current medications that our patient is on, just so that we get a better understanding of the medications he's taking and some of the reasons for it. So you can see that there are a couple of medications prescribed for essential hypertension. So as a result of consultation with my patient, I think we need to move him along to get some exercise tests to really understand what's happening and further diagnose his chest pain. So I'm going to be recommending he goes and visits the hospital. So I'm going to launch our secondary care demonstrator.